All right, what's up everyone? I'm Dr. Ryan. I'm a chiropractor here at Complete Rehabilitation, and this is Chaz.
Hi everybody.
He's a personal trainer over at 5 Seasons, director.
Thank you.
Yeah, the living legend. So we're just going to go over a couple tips you can use if you've ever experienced low back pain or have any issues with your back. We're going to show you a couple exercises.
Cool.
So, talking about the low back, some of the reasons why people get low back pain, the biggest predictors of low back pain is frequency and flexion, so continually bending forward to pick things off the ground, grabbing things off a desk, things like that, or prolonged flexion in the low back, or sitting for long periods of time. Those are the two biggest reasons why people will start to develop low back pain. So if you or someone you know does a lot of those motions or sits a lot at work or just at home in general, those would be people that might respond well to some of these exercises or these things I'm going to show you. And the reason that is because when the low back flexes forward, there's something called an intervertebral disc, okay? And that's kind of like a soft, squishy substance, like almost like a donut. It works like that, where when you bend forward or backward, there's a soft liquid in the middle, and then there's a firm outer layer, and that soft liquid in the middle moves with your motion of the spine. All right. So when you lean forward, that soft gel in the middle will push backwards on the disc, and that's normal in everyday motion. But when you move forward all the time and frequently do that, you're more prone to getting injured, or if you sit for long periods of time, it's the same thing. So one of the things that I always, it's kind of a test to see if someone will respond if they have low back pain. So if you have had low back pain for a long time, this might be a position to try. Or if you just recently started developing low back pain, this might be a good thing to get some relief in the meantime. So, Chaz, the first position, all you got to do is we're just going to come up on our elbows just like this, and you can see his low back arches a little bit. That's called lumbar lordosis. So when that low back arches, that takes pressure off the disc and starts putting that gel back into a neutral position. All right. So how's that feel?
Good.
You look good.
Yeah.
You can almost imagine like you're watching TV from the floor. That's kind of the position that you want to be in. And then, if this feels pretty good and is tolerable, sometimes you want to, in the same way repeated movement in bending forward can create pain, in order to reverse that, you want to repeat going into extension, okay? So Chaz is going to show us kind of a press up here, all right? So he's going to put his hands right by the shoulder, and he's going to come up, keeping his hips on the ground. He's going to try and lock out his elbows. Perfect, and then come back down. So this is supposed to be done repeatedly. So go ahead, Chaz, give us like 10. So as you repeat this motion, you're going to try and go as high as you can, keeping the hips on the ground, and that's going to also help push that disc back into its normal spot. Now the one thing you want to think about while you're doing that is that if you have pain, you only want to go up until you can touch the pain, right? So Chaz, let's pretend you have pain. So we'll come up right there, and then relax, and then come back down. When you do this repeated exercise, you just want to come up to the pain, maybe push a little further, and then come back down. Now the big things you're looking for is making sure that the pain decreases, or you get a little bit more range every time you do it. If the opposite of those happen, you start coming up and you have some trouble getting more range, it's going to get worse, right? So that's a bad sign. You want to stop doing this exercise. So I hope this helps. Chaz, do you have anything else you want to add?
It's helped me. Stay tuned for more.
Yeah. So so stay tuned for more videos. We'll talk a little bit more about hips and how that can affect the low back, and go from there. Cool.
Thanks for watching.